Hi, everyone. Today we'll be talking about mental health in Latine culture. We first wanted to preface with a brief discussion on terminology. So, you may not be familiar with the term Latine, but you likely are familiar with terms like Hispanic, Latino, Latina, or Latinx. All of these generally refer to the same ethnic and cultural community, with a few minor distinctions between them. So, for example, the word Hispanic references origins in Spanish-speaking nations and or nations formerly colonized by Spain. So it doesn't technically include individuals from Brazil, where the national language is Portuguese. The term Latino references origins in the nations of Central and South America and the Caribbean, where Romance languages, including Spanish and Portuguese, dominate. So this does include Brazilians, but would not include the Spaniards from Europe. You may also know that Spanish is a language that uses the grammatical gender, meaning that all nouns are either masculine or feminine. The terms Latino and Latina reflect this male-female dichotomy, but social efforts have led to the development of newer and more gender-neutral terms. The most well-known of these is the term Latinx or Latinx, which has gained popularity in the United States, but it isn't preferred by many within the community, as it can be seen as quote-unquote pretentious. After all, the letter X is an English pronunciation of the letter, and ending a word with an X does not follow traditional Spanish language rules. So enter the newest term, Latine, which is becoming more frequently used within the Spanish-speaking population. Unlike an X or X, an E or E at the end of a noun is found in Spanish and has gained traction in the past 10 years. So for this presentation, we will use the term Latine in an effort to be both gender inclusive and considerate of the concerns of the community itself. In the end, though, the best or most preferred term to describe someone's cultural identity is up to the individual. So I personally identify as Latina, but that might not be the right choice for another person. So make sure to consider every individual's individual preference before referring to them as any specific term. And with that, let's start our presentation.
Before we delve into the mental health portion of this presentation, I want to bring up some demographics. So currently, 19% of the US population are Latina populations. 62% are identifying as Mexican, 9.5% are Puerto Rican, 3.9% are Salvadorian, 3.9% are Cuban, 3.5% are Dominican, and 2.5% are Guatemalan. And it's projected by 2026 that the Latin population is supposed to make up 28.6% of the US population. That's almost double the amount, so Latin populations are on the rise in the US. Additionally, according to a Pew Research study, 83% of Hispanics or Latine are religious affiliated. In fact, 62% claim a Catholic faith. This is really important when we're talking about mental health accessibility, mental health perception, and mental health resources, because a religious faith plays a large role in how these are perceived. Additionally, according to an APA study in 2016, it was a stress survey in America. Hispanic and Latino Americans reported the highest levels of stress. The sources of stress might include financial instability, employment issues, health concerns, and familial instability. These stressors can, in fact, affect the others in your family, and so when we talk about stress, that isn't just pertaining to one individual, it might affect entire family. Additionally, it's really important to talk about the prevalence of mental health in Latin populations. So 10 out of the 60 million Latinx populations reported having a mental disorder. Also, out of these individuals, only 34% seek mental health treatment. That's less than half, which is a jarring percentage. So that's really important to highlight when we talk about mental health disparities and barriers to treatment. Additionally, serious mental illness is on the rise for all age cohorts, according to a study that was conducted within a 10-year span from 2008 to 2018. So for 18 to 25-year-olds, we see a 2% increase in serious mental illness. And similarly, in 26 to 49-year-olds, we also see around the same increase. We also see suicide and ideation attempts and death by suicides on the rise as well, about a 1.6% increase. And we also see problems with binge drinking, substance abuse, and these are often more comorbid with the mental illness diagnoses. On the right here is a graph produced by SAMHSA, which is the Substance Abuse and Mental Health Association. And this was conducted in 2013. And as we can see, the Hispanic population or Latino population are 27.3% using 23%. Sorry, I'm gonna start that over. 27.3% of the Hispanic population have been using mental health treatment resources. So that's pretty low compared to other races such as the white and the American Indian or Alaska Native races.
So Christine had given us some helpful demographics regarding the Latino population, and we can apply them to understanding the mental health challenges that this cultural community faces. To understand these challenges, it's important to consider the values and the beliefs of a specific culture. So one important cultural consideration for the Latino population are their religious and faith-based views. Some aspects of the religious culture can influence the likelihood for Latino individuals to seek treatment and seek help for their mental health conditions. And as Christine had mentioned, the majority of this community are of Catholic faith. There's a strong foundation or belief that religious faith can act as a source of strength and protection during times of stress or strains on one's mental health. And it is true that having such a foundation in a family, a home, or a community setting can provide a lot of comfort and protection, especially during hard times. What we want to highlight, though, are some beliefs that are typically involved in religion and faith within the culture. For example, it's commonly valued within this community that having faith and praying can remedy mental health conditions. Alongside this, it's also commonly believed that mental illness can be explained or caused by a lack of faith or sinning. And one phenomenon we stumbled upon in our research is this concept, el buen consejo, which translates to the good advice. This is a phrase referenced in many biblical proverbs, and it's considered to be something one should seek out and hold on to during good or bad times. In a community that understands el buen consejo to be a regular and important part of their livelihood, it can act as another protective factor, but it can also be a means to quell any concerns that one is having regarding their mental health, and might even result in the individual minimizing their concerns or their condition. And outside of religion, let's look at some other cultural considerations to take into account. One thing we'd like to note first is that the Latino community is a large and diverse one, and there are so many more unique identities, groups, demographics, different ethnicities, nationalities, and cultural differences that do exist within a population. And understanding this intersectionality, we're acknowledging that these certain groups do exist and might face particular challenges that others may not, but it can still influence the community together as a whole. So some examples include the immigrant communities and the undocumented population of individuals that exist within the Latine community. Outside of the cultural values that someone within this community embraces, we often see new and different challenges in further marginalized groups like our immigrant populations and undocumented populations. And these individuals are adapting to new changes and new barriers in their lives, as well as this sense of isolation or separation from the lives that they used to know. It's also common for members of immigrant communities to want to stay together, and while that provides a comforting sense of home and a shared culture, it can also add to that feeling of separation from the dominant culture in their new home. One other important consideration in this are the intergenerational traumas that are associated with immigrant and refugee populations. It's honestly a very packed topic to dissect, but the trauma that's experienced by individuals of these populations may often remain unresolved and can manifest in the parenting of younger generations. And one phenomenon that's related to this is known as the immigrant paradox, which refers to the phenomenon that immigrants are recorded to have lower rates of mental health conditions than that of native-born Americans. Much of this can stem from the fact that these populations and generations have had to overcome so much that by achieving their desired outcome, which is to give their families a better life in this new home, was worth much of the mental strife that they endured. And without realizing it, this mindset may be pushed onto and affect the mental health of younger generations. On the other hand, that still does not encourage us to ignore the fact that both immigrant and undocumented populations are challenged by many stressors and distress-related mental health disorders, particularly for individuals who live in fear due to legal status. These barriers to mental health care are significant. One other concept, known as familismo, or familialism, is a strong and significant ideology that prioritizes family, especially prioritizing the honor of, the support of, and the connection of a family. And it's an especially protective value for many Latine families. Past research has indicated that families that are very strongly tied together by familismo have reportedly lower rates of mental health disorders. But in more recent findings, researchers are seeking to better understand this phenomenon, as this cultural component is not studied enough. Some research has indicated that members of younger generations, in particular, feel that they've been taught to internalize their emotions and their mental health concerns in order to maintain the cohesion and relative happiness of the family unit. And among all of these identities and cultures, one of the most important considerations is, how does this translate to the access to mental health care? Some of the barriers that this community faces in accessing mental health care are strongly interconnected with the unique challenges their communities face. For example, language barriers. Even for someone who speaks the same language as their provider as their first language, it's already hard to communicate concerns of mental health. For someone whose first language is not English, this can be especially hard, and especially in an environment of communicating mental health concerns where we're encouraged to verbalize very specific emotions. One other barrier is poverty and health insurance. More demographics for you. Individuals living in poverty have a higher likelihood of developing mental illness, and 15.7% of Latine people in the US live in poverty, with 19% lacking access to adequate health insurance. Lastly, one very significant barrier, the need for culturally competent care. Without understanding the values as well as the challenges that individuals of different cultures face, a mental health provider can have a more difficult time in understanding and accurately diagnosing their patients. So, without understanding familismo or the challenges that the immigrant and undocumented populations face, can often make it harder to relate and to accurately diagnose their patients. It may result in the misdiagnosis or mix-up of different mental health disorders. So, from all of this, what are some of the practical examples that we do see? Culturally bound syndromes, as defined by the APA, are patterns of mental illness and abnormal behaviors unique to a specific ethnic or cultural population. And usually these syndromes don't conform to the standard classifications of psychiatric disorders. For this presentation, we'll give some examples of culturally bound syndromes seen in Latinx culture. So one example is ataque de nervios, and this affects Latin American, Latin Mediterranean, and Caribbean cultures. It's characterized by bouts of uncontrollable shouting, attacks of crying, trembling, the sensation of heat in the chest rising to one's head, as well as verbal and physical aggression. Its most common characteristic is this feeling of being out of control or lacking control of a situation, and typically occurs after a distressing event towards family. For example, losing a loved one or having a loved one be sick or ill due to an accident.
So, a second type of culturally bound syndrome is mal de ojo, which is directly translated to evil eye in English. It's most widespread in Mediterranean and Latinx cultures and is characterized by both mental health symptoms and physical symptoms that might be a result of the mental health symptoms. So, for example, anxiety, depressive episodes, fever, sleep disturbances, or insomnia, and gastrointestinal issues might be a result of mal de ojo. Also, mal de ojo is known as a curse and a weakness that is often stemming from a sort of jealousy or a wicked glare from an external individual. And it's often cited that infants and children are most commonly affected by this because they are at their most vulnerable stage in their lives.
And a final culturally bound syndrome that we'll talk about is, it comes in several names. The idea of susto, which translates to scare, miedo, or fear, espanto, or terror, and pasmo, or astonishment. All of these describe an illness that is attributed to a frightening event that causes the soul to leave the body. And like mal de ojo, is also characterized by both mental and physical symptoms, which include appetite and sleep disturbances, troubled dreams, muscle pains, headaches and stomach aches, sadness, a lack of motivation, and feelings of low self-worth or dirtiness. All of these symptoms may be related to DSM-5 disorders of major depressive disorder, PTSD, or other somatoform disorders. So taking all of those into consideration, and in addition to the community barriers to mental health care that Ali spoke about, one of the biggest barriers to seeking care in Latina culture is stigma. So when we think about stigma, for one, people may be discouraged to seek help for mental health struggles because they don't want to be labeled as, right here in the center, loco or crazy. Another common saying in Latina communities is la ropa sucia se lava en casa, which is similar to an English saying, don't air your dirty laundry out in public. So this contributes to the idea that mental health issues are taboo and should not be talked about. Other cultural stigmas include that mental illnesses like depression are due to a moral or spiritual failing, or, as Ali mentioned previously, a lack of faith, and can therefore be seen as shameful or signs of weakness. Mental illness may also be seen as punishment for the sinful behavior of oneself or one's loved ones, and may be seen as a mark on the whole family. So how do we move forward? Well, Ali spoke a bit about this idea of culturally competent care, and it is so crucial to providing mental health care that considers all of these cultural factors and barriers we've spoken about so far. Providers who are trained in cultural competence should do what they can to remove the language barrier, ideally by being fluent in the patient's preferred language, such as Spanish, or by having staff or interpreters on hand that are fluent in the patient's preferred language. Providers should also be educated in the cultural influences and terminology around mental health and mental illness, some of which we've talked about today. They should address the unique cultural stigma around mental health that we just delved a little bit into. And they should understand Latina cultural diversity. So you can't just approach all people within the Latina community as a blanket method. As Ali mentioned, there are so many countries and smaller communities that relate to specific ethnic, religious, and other groups within the Latina community that make each individual very unique. And part of cultural competence is recognizing this and coming to each individual where they are. So if you are looking for help as a Latina individual, or you know someone who is looking for help, here are a few resources that seek to provide culturally competent care. So one is the National Alliance on Mental Illnesses, Compartiendo Esperanza, or Sharing Hope, which is a mental health awareness video series that seeks to educate Latina Americans about mental health. The American Society of Hispanic Psychiatry promotes the research, education, advocacy, and support for those in which they identify the Hispanic community. And they also offer a Find a Physician feature on their website to find culturally competent and Latina physicians in your area. Therapy for Latinx is a database of therapists who either identify as Latinx or have worked closely with and understand the unique needs of the Latinx community. And finally, Psychology Today is another database of Hispanic or Latinx mental health providers across the US that you can filter by your location and many other helpful criteria. And here are the resources we used to create this presentation, which you can find in the description. And thank you all for your time.